I'm Minetta Liu. I'm a medical oncologist by training. I was in academic practice for about 20 years taking care of breast cancer patients. Then about 3.5 years ago, I joined Natera as the Chief Medical Officer for Oncology and Early Cancer Detection. In routine clinical care for patients who are diagnosed with breast cancer, we use what I consider basic tools. It's a physical exam, it's breast imaging studies, sometimes we take pictures of the whole body, and there are some blood tests called tumor markers that we've historically used, CEA, CA15-3, and CA2729. And although they're helpful, they're not that specific or sensitive. So for the longest time, we've needed a more reliable blood test because the goal would be to identify breast cancer coming back as best as we can so we can optimize or make our management treatment decisions more effectively. So circulating tumor DNA with new technology, we can detect these tiny little bits of tumor DNA in the bloodstream, and that enables us to know if tumor is still present. Circulating tumor DNA, or ctDNA, is a term that refers to fragments of tumor-related material that we can find in the bloodstream. DNA is the coding material of all of our cells, so it's in normal cells as well as abnormal cells. When you do what's called germline genetic testing for hereditary cancer risk, that's looking at what you were born with, so what we would call normal cells. When we are looking for circulating tumor DNA, or ctDNA, we are looking for changes in that normal coding material that you were born with that changed to become a cancer. So we can look at the specific characteristics in the bloodstream to track what's happening to a patient. Right now, circulating tumor DNA tests are not yet in guidelines. But we know that the test can be helpful based on the studies that have been done so far. So right now, providers and patients are thinking about using the test where they need an additional piece of information. So at the time of diagnosis, we can draw a blood test and we can help understand what the risk of recurrence is. So it's what's called prognosis. It's trying to predict what could happen to the patient. So this can help us at the time of diagnosis make decisions about the type of medications to prescribe. Maybe someone needs more than you'd think. Maybe someone needs a lot less than you'd think. And it'd be much better to tailor treatment based on risk than just give what we think based on tumor stage and other basic factors. Circulating tumor DNA can be detected by a simple blood test. So it's a blood draw, just like we do every day for patients, even in routine healthcare. We can detect these little fragments of tumor DNA using basically two different kinds of tests. One is a test that we call a tumor-informed or tissue-informed test. That means we need a sample of tissue, we need a sample of normal DNA, which usually comes from the blood, and then we need a whole blood sample that presumably contains the circulating tumor DNA. The advantage of using a tumor-informed test is that we can create a fingerprint for that specific tumor in that specific patient. You can also use a blood-only test, meaning you don't need a sample of tissue, and it's strictly a blood test, so it's a little bit easier, right? You don't have to go find the tumor tissue that was collected at the time of diagnosis or time of surgery, but you use a panel, so it's like one size fits all. What's exciting about the future is the development and the building of evidence to get this testing into guidelines. We want to be able to clearly tell providers and patients how to use the test, when to use the test, and most importantly, what do you do when you get the results? For me, the most exciting thing is the future for what we can do with ctDNA detection in transforming how we take care of patients, not just by a better means of making a decision about routine care, meaning treatment or follow-up, but also creating an entire new space for how we manage patients.